Hi, my name is Dr. Maureen Flynn, and I'm the principal investigator of the study that you're participating in, What People Care About. I just want to spend a few minutes to tell you a little bit more about this study. So, your values are reflections of what is most important in your heart, what sort of person you want to be, what is significant and meaningful to you, and what you want to stand for in this life. Your values provide direction for your life. Some psychotherapies target values. Three examples of therapeutic interventions that target values are pleasant event schedule, behavioral activation treatment for depression, and acceptance and commitment therapy. So, an early hint of values in therapy is the Pleasance Event Schedule by McPhillamy and Lewinson. The inventory includes a list of 320 activities that a client can rate how often they've engaged in each activity in the past month and how enjoyable they found each activity when engaging in it. Clinicians use this list to help clients become aware of the frequency of positive events in their lives and their subjective enjoyment of these events. While pleasant events are a step in the right direction, they do not serve as the same long term function as values in therapy. The events may be related to values, like eating dinner with friends is related to the value of being a good friend, but the pleasant event schedule protocol does not state that explicitly, nor has it been studied in this regard. Behavioral activation treatment for depression combines these approaches by taking goals set by the client that are consistent with their chosen values and increasing the frequency of the behaviors related to those goals and values. Clinicians using behavioral activation treatment for depression uses a values-driven framework to increase the frequency of valued activities amongst individuals with depression. In behavioral activation treatment for depression, clinicians work with clients to identify values using a values assessment protocol. The clinician and client then develop goals that the client can work towards that help them contact specific values. A structured schedule of activities may be set that the client can follow and report on in sessions. Values driven action, also known as valued living, is the main goal of acceptance and commitment therapy, as opposed to reduction of symptoms like anxious worry or negative thinking. Consider a client presenting with recurrent worries that their friends do not like them. A symptom reduction oriented therapist might lead them through exercises designed to reduce the frequency and intensity of those worries and negative thoughts. In acceptance and commitment therapy, therapists, in contrast, would target behaviors that would bring the client closer to things that he or she cares about, like going to parties with friends, without directly challenging or changing these thoughts or the feelings associated with them. Through acceptance and commitment therapy, clinicians can help clients approach their values in a number of ways. One example is using an exercise and worksheet called the bullseye. Using this exercise, individuals focus on four particular values domains: work or slash education, leisure, relationships, and personal growth slash health. Clients first identify their values in the four areas. They then receive an image of a bullseye, which is split into four quadrants representing the four valued domains. Therapists then instruct them to put an X on the image at the point where they feel they are at this point in time for each of the four domains. The middle of the image, i.e., the bullseye, is labeled "My life is just as I want it to be." The edge of the image is labeled "My life is far from how I want it to be." The worksheet can then be used as a guide to further discuss client values in therapy. Haynes and Coyne developed a card system to encourage younger clients to get in contact with the things they care about. Their values cards include images and simple phrases that youth can visually see and understand. For example, the Forgiving values card has a picture of two people hugging. The images are bright and eye-catching, but also ambiguous enough to occasion a variety of interpretations and open-ended conversations on values held by young people. These cards might be used in individual or group therapy. Another way to get clients in contact with values is through value-based experiential exercises, a prime example of which is the sweet spot meditation. Therapists ask clients to bring to mind a sweet moment in their life. The therapist asks them to notice small details of the sweet moment, such as colors, temperatures, and smells. They ask their clients to notice any thoughts or feelings that were present in the moment of sweetness. After the exercise is complete, the debrief might entail working with clients to connect their sweet moments to values they currently hold or would like to develop. Although such values work is ongoing in several clinical approaches, such as acceptance and commitment therapy and behavioral activation treatment for depression, these interventions are complex, making experimental analysis difficult. As with many aspects of behavioral treatment, experiments bring new data and questions that form the bridge between clinical intervention and well-controlled laboratory research. In other words, experimental research in the lab can provide a foundation for improving or coming up with new clinical interventions. Values intervention research includes different methods to get participants thinking about their values. One method is interviewing. For example, Paez-Blarina and colleagues conducted a pain task that measured the effects of an acceptance and commitment therapy values protocol, a pain control protocol, and a no values protocol. In the acceptance and commitment therapy values protocol, participants were prompted to think about and talk about times when they did something difficult because it was in line with something they valued. In this condition, the pain was framed as a values-driven action. In the pain control values protocol, the pain was framed as going against values action. Participants in the acceptance and commitment therapy values group showed significantly more tolerance for pain than the other two groups, as evidenced by continuing the pain task even after a very much pain rating was given. Another method is values writing. For a set time, participants write about areas in their lives that are meaningful to them. Values writing has been shown to increase academic performance, openness in smokers, and greater feelings of love, connectedness, empathy, and giving. The most common methods of obtaining values from research participants are through questionnaires that give participants a list of common values and have them rank their values and/or evaluate them on a Likert scale type, such as 1 equals not at all important and 10 is very important. These studies include questionnaires such as the Valued Living questionnaire that you see on this screen, the Values questionnaire, Portrait Values questionnaire, and the Personal Values questionnaire too. For example, Cresswell and colleagues used the Values questionnaire where 5 personal values, religion, social issues, politics, theory, and aesthetics were defined. Participants were then asked to rate and rank these values in order according to their personal preference. After ranking, participants were split into 2 groups. One answered multiple choice questions about their top ranked value, and the other answered multiple choice question about their 5th ranked value. The top ranked value group showed lower cortisol levels after stressful tasks than the 5th ranked values group. So this brings us to the current study. There is a growing interest in having research participants contact values to examine the impact of values on behavior in laboratory settings. However, there's been little research on which method of producing value stimuli, such as values writing or choosing from a list of common values, produces the most effective experimental stimuli. Knowing this method would allow the investigator to quickly and easily make values present or not present for participants. Therefore, in this study, we're examining which of the following methods produce the most meaningful representation of values for participants: word selection, picture selection, values word generation, or values writing and word selection. And the information that we get from this study may help future research by targeting values in a way that is most effective. So thank you for listening to a little bit about what this study is about, and thank you for participating.